address is have in a school setting, in age-appropriate adolescent healthcare services, where there's like counseling on abstinence, like we're talking about. If it's not on abstinence and they're already engaging, then they are also counseled on the effects of, say, abortion. And I know there was a big issue on consequences of unsafe abortion. That was one part of the bill, on the bill. And we've had people complain about the unsafe.
It legalizes the killing of disabled and mentally retarded persons in their preborn stages of life. Every unborn child has a right to life. For children between the ages of 10 to 17, that they should receive contraceptives, safe abortion, and comprehensive sexuality education, which teaches that sex is for pleasure and that sexual pleasure is a right. If we allow sexual pleasure to be taught as a right, what happens when one wants a pleasure and there is no consenting partner of the opposite sex?
That is misinformation, that is malice, and that is just intended to whip the emotions of the public, because there is not such a thing in the bill. It is a reproductive healthcare bill, not an abortion bill, not encouraging rape, not encouraging underage sex, and definitely not encouraging same-sex marriage.
It should be clear to that teaching sexual pleasure as a right would automatically create perversion, and they will engage in masturbation, same-sex relationships, rape, bestiality, incest, teenage sex. Such behavior will also lead to increased demand for abortion and eventually unstable families in future. So as church leaders, we find this to be wicked and abominable before our God.
Have been quite alarming. And we want to agree with Professor Magoha, who said that these numbers may not be real. Because we have seen a trend. Every time this kind of a bill is in Parliament, it follows with a research